up until this point, if we've had notice through our crisis response team, have worked the protocol, done a safety action plan, we've not lost one kid. That's dramatic. The kids that we've lost have been the low liars who didn't access support or chose not to do it, or we didn't know about it. So again, this is a very effective way of management of these kids and letting them know they're not alone. Okay, so again, this is a real critical thing. So as admins who are on here, please start thinking, who do I, on my crisis team, who do I have identified that should be part of the suicide response team? What we've seen to be most successful is the school psych, school nurse, social worker, school nurse, I'm missing one, school nurse, psych, social worker, counselors. Your SSPs, whomever you think has kind of a social emotional element. I've seen in some schools the deans, some of the APs have had established relationships with kids, and so that becomes a very positive one. So from an admin's perspective, you as admin have to be in control of all of this. We, though, as the practitioners, have to work as a team. So first step, think who would be the people you need to have on here, okay? Now, can I go to the next one? No, Becky, I think you're gonna have to do it. Okay, guys, these are older stats, and I looked at it last night thinking, should I keep them on? Yeah, I am gonna keep them on. If you can go back to 3, I think. Go backwards, one back. There we go. Guys, this is the typical profile. That's why I wanted to keep it on. Males are much more prevalent. They have, once they've made up their mind, typically they do it, and they have more access to things that will truly hurt them. The females are the ones, though, that maybe they talk big, but tend not to use as lethal a method of doing things. The overall hanging, ingestion, and firearms tend to be the most common usage of a completed suicide. That's why part of our goals here are to talk to parents when we do a safety action plan, when we're talking to them, look in the house to see what could be done. Kids get very creative when they're desperate. And we've seen that. And throughout the training, I'll remind you of some things that we've seen that are just disturbing, that kids get so, when we don't know about it and we find out after the fact, how they've become very creative in their methods to do things. One issue, Native Americans are jumping up in numbers. And if I had stats, I'd put them in here, but we're strongly worried about the fact that now kids are home, they're feeling isolated, they're separate from their support groups, and that is a problem. So we've got to deal with that issue. Becky, can I have you go to the next one? Okay, guys, let's see. Can you get to oh, let's see. There was one. Well, there it is. Perfect. Statistics. Again, we were 1 and 2 at one point when this all started, and I have to share with you the history. CCSD at the time when I was there as an admin was very lucky to get a $6 million grant. We were able to put together crisis response protocols, threat assessment protocols, and then with all of these things, I sent them to the nationally recognized people in the country to review them to see if we've missed anything or how would they improve it. And they liked what we had put together. So I'm pretty confident what we have is good, but we're always open to suggestions if you see something that can be done that would be helpful. But at that time, again, we were between 1 and 2. We were ranked at 11, as of now. The stats come in yearly through through Richard Egan's Suicide Prevention Office. And what he shared with me probably a week ago was the numbers are going up and he's getting worried. So I think we all have to kind of look at that piece. We've got a problem. One way they get their methods is through the youth risk behavior scale, which is a stat, they get the stats on that. Now this is an older data, but it's very consistent, but this tells you where kids are coming from. Have you considered suicide? 1/3 of our kids have, and it hasn't changed. That's what's it's sickening. Do you have a plan? That's even a bigger step. Not only have I thought about it, like, would life be better without my being here? Yeah. But then when have they thought and put together a plan? Well, if I did this, then I wouldn't be around. Yeah. 16%, almost 20%, 1/5 of the kids have. And this is probably the most disturbing. And that's why I left this screen up, these stats up. About 10% of our kids have already attempted. We may not know they weren't successful, thank God, but the problem is they've attempted at some way. And we'll talk about attempts in the meantime, in a bit, okay? All right, Becky, thank you for helping me out here. All right, guys, I want you to be aware of some legal issues because we're really walking a kind of a scary slope that can go pretty quickly, and I want you to be aware of what's happening. Oh, okay, we're with this piece. All right, well, this is the newer stuff from Richard that I got. 27 deaths, 19 within Clark County, that nearly doubled the youth reports suicides in 2017. And that's what he was referring to. He's seeing a gradual increase, and he's really getting worried because he has the global statewide stats. So we've got an issue. I think we've got to really take some pause with this information. Okay, Becky, if you can go to the next one, my dear. Okay, guys, the legal issues. These are important. I feel I have a duty to do to tell you what you have a duty and what people will be looking at. Yes, we're going to send the PowerPoint. Yeah. In loco parentis, I need to make sure you guys understand this. Once a kid walks in the door in our school, we're the parent. We have to make sure that we use good judgment, that we're keeping our eyes open. Due diligence and systems, standards of care is a system set up in a way whereby if we see something, we've got to take action. And I'd rather have you all function on the level of overdoing it, over considering the issues, because if we were to become culpable, the issue will be, what did we do? How did we, what managed, what happened here? So please think ahead. There are multiple lawsuits, and I try to keep track of all of them. Foreseeability and negligence are very much connected in the fact that if a kid demonstrates issues that would suggest we need to investigate, or we will give the appearance of negligence, that we had the information and we didn't do anything about it. That's what precipitated setting up a program where we will work with you on signs of suicide, the SOS program, and each school needs to have kind of a system in place, a go-to group of supporting adults who can be there for our kids when they start to deteriorate, and a system whereby we can communicate with each other. So therefore, if we hear something, we can pull the kid in and help them figure out what's going on. So again, those are core issues, and all the lawsuits that I've read pretty much pointed at the schools saying it was right in front of you. Why didn't you do something? And that's why the bottom line down there is inaction equals negligence. We've got to be very careful. There's a situation called, not a situation, but it's a ruling, and it started out in the circuit court that we're in, but it's nationally recognized. Duty to warn, it's Tarasoff. Duty to warn, duty to protect. If we have information that a child is in danger of himself or others, we've got to take action. So that's why this is so important, that if we hear something from the kid or through the threat assessment process, somebody's at risk, we've got to take action and do whatever will be needed so people don't lose their lives. And truthfully, honestly, guys, we want to sleep at night. I keep saying that to everyone. You want to go to bed at night knowing you did everything you possibly could. So we have a moral issue, an ethical issue, and then there's the legal issue. Okay, Beck, can you flip to the next one? Guys, this is kind of just a reminder. But what it reminds us of is that there are 4 elements in a crisis response plan: prevention, preparedness, response, and recovery. Guys, you're part of all of this when it comes to suicide. We can prevent by doing programs like Signs of Suicide, by showing kids that we're available, setting up possibly a mailbox and saying, if you have a concern about your friend, put this kid's name in that box. Preparedness. We have all the documents for you that you will need to have when you do a suicide response protocol. And when we talk about threat, you'll also have those docs. Have them ready. Be prepared. And truthfully, there isn't a case I don't walk into where you're holding your breath and you're kind of scared what's going to happen. So by doing it, at least by practicing, it'll be more comfortable for you. The response is actually the in-person kind of direct support that you're providing the kid. And I have some tips for you that will work, because I've been duped. We've all been duped at one time or another. I've been duped, and I'll fill that in on you. I'm not embarrassed to show you. Everybody's open to it. And lastly is recovery. How to recoup? How do we need to really pull our team together, see how we could have done it better, what worked, what didn't. And so following these steps really make it a more efficient process, and it gives you a sense of control and the fact that you'll find your little kinks in your armor and figure out what to do next. Okay? All right, my dear. Okay, so guys, this is for admin, but it's also for you. Establish a psych team. Find out who's there. Again, your core people for suicide should be the psych, the social worker, school nurse, that whole crew that I've talked about, possibly the dean who has good connections with the kids, whomever you think will be there, that we've got to do a full team effort. And you almost have to think, who do I work best with in doing these kinds of interviews, because they are a back and forth interview process. And I'll explain that when we get to the interview piece, so that way we're able to better understand it. There has to be a communication system. I can't tell you how many times I have been either at home or ready to go home or getting ready to go to school and been told, we've got a problem, everybody. We got to get here as fast as possible and take care of this situation. Practice is the issue. And I wrote in here at the bottom is something to the effect, please prepare protocols, have packets ready to go, because I'll tell you what, your brain goes a little dead there for a little bit. And by having them there in your hand and ready to go, it's one less thing you have to worry about. Okay? All right, my dear, thank you. Okay. Who's the team members? I would strongly suggest you look at your team, who's available, the skill sets people have, but in essence, site-based staff that you have that can handle the situation. We've got to, don't forget, manage the parents, because they're in crisis too. And very possibly you will need the police for a couple of reasons. Possibly the family's out of control, meaning parents will come in, and we've seen that, where parents will get, what are you doing here? This is your fault. Give me my kid. I'm walking away from this. To having kids run away. So the core team can expand because you might need some additional assistance. Okay? Okay, my dear. All right. Our trained staff, I've put there who would be the baseline for types of people to be part of the core team. But the real issue is who can engage, who has skill sets that will allow us to be calm, talk calmly, have a better flavor of the protocol so you don't feel like you've lost control. The issue is you have to stay calm because everybody else is probably kind of panicky. So especially when parents walk in the door. So it's very important to be able to connect with a kid, engage, and do that tap dance back and forth with the kid to find out what are the presenting problems. And again, we've got to keep the parents calm, because a typical a typical parent will be panicky when they walk in the door. Those people will have to triage, do the assessment, triage, and make determinations about safety. So please keep that in mind, that this is a pretty serious thing. We have to ask the right questions. That's why we've given you a very set protocol of which to go through. So we address all the core issues that from the standards of, best practice. Those are the questions we need to know. From that, then we have to make a plan on where we're going and then figure out how we're going to implement it. One thing I want to share with you is synergy works. So when you engage and you work with a team, guys, you got to kind of go through your protocol, but I have to share with you, it's impossible to do it alone. You've got to have someone with you to work with you to either log what's being said, help you problem solve. It gives you a chance to catch your breath while you're thinking. So again, it's a two-person deal, at least for the interviewing process. So again, synergy and engagement are core issues here. Okie doke. All right, guys, these are the kind of red flags we're starting to say, whoa, watch for this, okay? Talking about suicide. If we find out from kids' friends, and kids have been wonderful, they will report this. Kids talk about it. If we find notes, if teachers see writings in with regards to, something they've done for homework, I can't tell you, I've kept papers where they're supposed to do a project and the themes are dark, grim, or actually talking about it'd be better if I were not here. Those are the kinds of things, those are catalysts for us to say, okay, we're running with this one. If there are any prior attempts, we've got to keep an eye on those kids because that raises the risk much more seriously. If a friend of the family, a special friend of the kid, someone connected to the kid has committed suicide, those also up the ante for statistics. If we see this kid being more seriously depressed or saddened, feeling hopeless, those are problematic. Dramatic changes of behavior, they're taking unnecessary risks, loss in things, lack of connectedness, sense of being a burden to others. Now, why I'm reading that is you're going to see this in the interview process. We're going to catch these questions with and talk to the kid to see if any of these points are coming out. The more points and more areas that are problematic for the kid, the more we have, our angst goes up because then the issues become problematic. And as we get to it, I'm going to show you. In essence, I have it over at SRA, but I have one of those scale of justices. And what you're in essence doing is you're looking at all the factors that are problematic versus what are the supports for this kid and weighing out what to do. There's no formal yes, no formal no. It's using clinical judgment to figure out what we have. One last thing is the burdensomeness. And when kids become pretty dramatically embedded in this issue, they feel like the world would be better without them. Their parents would be better, and that's called burdensomeness. And that's an issue that's very problematic. Okie doke. Becky, can you flip it, or is that possible? We lost your picture. Maybe not. There she is. Awesome job. Awesome, awesome. Okay, some things I wanted to talk to you about. When there are sudden changes in behavior, we start to worry. That's when you have a kid who relatively is, doing their thing, but if we see changes in how they look, their personality, their relationships, their academic prowess or lack thereof, that's a problem. That's what we have to deal with. This is probably one of the highest things when kids make arrangement, put affairs in order, give things away, where they're saying, now, I think I'm done. I've had it. I'm going to move on. That's a problem. Now, there was a point here that someone had discussed, and I thought we probably should talk about. A cry for help is good. At least we're hearing from the kid. It's the ones who are the low-lying flyers that you worry about that are being quiet. Remember I said a couple of minutes ago, we had 100% success in doing this. It's the ones that we didn't know about, where there was nothing stated, nothing, they didn't let us know because they start to hide it because they've made up their mind. Those are the ones we've just, that's devastating, and we want that not to happen. Now, one thing I was thinking about, truthfully, when I was looking this over, and I put it in one other screen, sudden changes in behavior is just as dramatic as slow, gradual, diminished functioning on a kid. So the changes could be there, but then if this kid has from here gone kind of downward in a slower slope, we've got a problem too, because something's wrong. It may not be suicidal. On the other hand, all that kid needs is one little trigger, one little problem, and they might jump over the edge. So we've got to keep an eye on those kids too. Okay, Becky, can you, okay, thank you so much. I appreciate it. These are what we're looking for, and you're going to see the protocols reflect this 6-component system. And what it is a compilation from a variety of sources that nationally, truthfully, I pulled from and got the data from research, from good practice, got it from national organizations, and it really does hit the areas we need to know. Is there a detailed plan, and where is this kid on the pathway to violence? I'll show you what that pathway is. We're looking at history, risk factors, and what's called habituation, which I'll explain to you in a minute. There are always, they talk about risk factors and warning signs. I'm going to show you the difference. And again, there's that underscoring perceived burdenness. You know, sometimes kids think they can manage, but if they feel they're a burden to the people they love or did love, that puts them over the edge, and that's a problem. There are other issues called connectedness. Who are they connecting with? Who are they engaged with? Do they feel like they want to belong, but it's being pushed back, so they feel like nobody loves me? And then a core issue here in that section, because it has to do with connectedness, is protective factors. Many of our kids, and we saw it across the board in Las Vegas. It depends on the system and the family environment. And there are things, if some of our families, and that's I think why I'm so worried, I know everybody's worried, because the situation is so, everyone is in such an unknown situation and under such critical stressors, and we'll talk about that for number 5, that their protective factors may be diminished, and the kids take it personally, or they need those factors so badly that they become diminished in their ability to manage in an environment. Current stressors, we've got to find out from the kids what's bothering you right now. Remember, there are kids who can stabilize, but something might throw them over the edge. That's what we've got to worry about. Are there things that just happened? And very interestingly, when we hit that section, there are things we never would have thought of, but they were enough for that kid to just say, oh, crap, I've had it. I've had it. And last thing, which is very, very critical, equally amount for all the ones above, is your clinical observation and the presentation of the student, which means, that's why I say you should have a couple people doing it, because you've got to watch how that kid tap dances with you. Watch his reactions. Are they highly defended? Are they being open with you? I mean, there's so many things you got to look at, but that's a critical piece. And oftentimes, I know this sounds stupid, but oftentimes we use our clinical just judgment. You know it, you feel it, you can see, then you have to identify what is it about what that kid's presenting that makes me feel that way. Okay? Okay, Becky. Guys, and now Becky, what's going to have to happen is you're going to press the clicker, whatever the hell, the clicker thing, and it's going to go up. This is called the pathway to violence. It was, so I didn't come up with this concept, someone else did, and it's perfect. What happens is kids start thinking, and then you combine it with some pain or difficulties or challenges that they're not up to. And then Becky, if you keep click it again, they start going up this pathway that gets them closer to looking at points. And that's part of our job in looking at the protocol. Where's this kid thinking? Usually it's on the lower levels where life sucks. They're starting to say, I don't like this pain, I want to move on. And they think, maybe suicide or sleeping for a long time would be a good idea. And the only solution they have is very possibly that death can be the answer for them. That's how they start thinking a plan. That's where they start looking to see if they have equipment that they can use. And we'll talk about that too, because they get creative. And then move forward. You can see at the top of the thing, if they start making, remember I commented, giving things away, making final arrangements, a sense of peace and happiness are our biggest worry, because that's that calm before their storm ends. So we've got to see where they fit in and stop it, move it forward. Okay, thanks, Becky. Okay, I put this in yellow, guys. Never leave the kid attended. I will tell you my big mistake that I made in my career, and I was like, oh, God, help me. How did that happen? I was at one of our local high schools, and we were doing a suicide protocol, and up front in the school main office, and we had contacted the parent. The parent walked in the door. I turned around. She grabbed the kid and ran out the door. Now, it was a high school. We had school police, and they were gone. They were gone. We had everybody on the radio using our local, because every school had a school police officer. We searched the campus. Those parents flew out of there with that kid. And you know what? Then we called Metro, and sadly, they went underground. I don't know where the heck they went. We could not find that kid. I think eventually it was like days later, the kid finally came back to school, and then something had to happen. There was involvement, because this kid, they were hiding. They were underground. We could not find them. Do you know, that night I couldn't sleep? I mean, and it happened that fast. So always keep the kid, if you have to, even keep the parent and the kid separate in separate rooms. If your parent walks in agitated, God help you, then you may have to keep them separate. See, we don't have school police. Get your admin, and you might have to call the police for support. Because I got to tell you, the presence of a police car, a couple times we just had the presence of the police car out front in the school, is sometimes just enough for people to manage themselves, because parents are in a sense of panic when they see all this going on too. For you guys as practitioners, I have to tell you, do the best you can to remain calm. That's why I said look over the protocol, even talk with your colleagues, so you can kind of figure out how are we going to do this, because there's always a saying I used to use for crisis planning, when you can't plan a crisis when you're in the middle of one. You can't think, let alone plan for one. So you have to kind of think through, okay, who's going to be doing this? Let's learn how to tap dance in the conversation. Sometimes you need that break so you can think and let the other person take over, and one will scribe and the other will interview. So again, you got to stay calm, because you can miss some core points, and also kids pick up on our anxiety, because then they feel things are more out of control than they can control, and we don't want that. We want to provide a sense of calmness. Now, how do we do that calmness? Start practicing. Sit in your chair. I was always taught with relaxation. Put your legs near the edges of the chair. Put your back as far back so you can sit back. You've got to breathe, and the room needs to be set up in a manner that you feel you're in charge of that room, and we'll talk about that in a second. Breathe. That's another element. When we're tense, sometimes we breathe short breaths that are not deep. You got to keep breathing. You just have to, and talk slowly. Okie dokie, guys. All right. Beforehand, again, provide supervision for the kid. I'll never forgive myself for that kid that flew. I'm just blown away that happened. I just turned around and he was gone. And we had it set up that there was control in the environment there. But boy, that mom was quick. this is what I wanted to share with you. I brought it up before that we would talk about this. Clear your office of dangerous items. Anything that you think the kid, in a sense of panic, could use. So it would be any sharp implements, anything that they could tear or throw at you. Could they turn a desk? If there's a desk, a child desk in there, or anything that you think that could be problematic. I would, if I were you, do the seating in a way where you're near the door for two reasons. If the kid is thinking to run, he's going to have to run around you. That's one core piece. But also, if they do find something that you didn't realize was there and they go after you, you run, get help and you run. So set up the seating environment in a way that you're protected, because you never know in a case where people are feeling pretty panicky what's going to happen. Okay? Have all your documents available. That's why I said, if I were you guys, and we do it here, we used to do it over at my old department, we had packets ready to go, because you want to walk in ready to go with your protocols. Now, one issue, you might have to, may have to have your secretaries or somebody do it for you, pull up the demographic information, so you have the student name, parent name, all that kind of stuff. So that will make it easier for you. But having this stuff available, it will make this so much easier. The last thing you want to do is start rummaging through and not knowing what you need and what you might be missing. Okay? Okie dokie. This is a core issue when we learned it through experience. That's why I said, guys, if you see something and we can enhance this, please let me know. But we learned this one along the way. If the kid has a provider, find that out right away from the parent or guardian. Call them and say, we have your patient or client, they're in distress. What would you want us to do? Most of them will say, bring them to my office, but I've had multiple ones say, I'll meet you at the hospital. So do that. Find out if there is a provider. They have a right to know that they've got a situation. Even if we didn't know they had a provider, that's a very interesting piece. But also we need to know what they're doing, and they need to know that this kid's in crisis. Now, everybody's worried. We all worry about legally, what about confidentiality? This is one area that all bets are off. We can do things without a release of confidentiality. So if you're thinking, oh crap, I don't have a release and the parent isn't here yet, and this kid is ready to pop, what do I do? You can call. Later on, we'll talk with the parent. Parent says, for the most part, 99% of them are reasonable. They recognize that we're trying to save their kid and get a release later. But at this point, that's one of the health and safety issues. We do not have to have that permission to get information. And if you come across a practitioner or a practitioner's group and says, no, we can't, then you just decide what to do. You might end up having to send the kid to the hospital. Okay? Again, bottom line there is that Tarasoff ruling, which started in our jurisdiction here but went nationally. Duty to warn and duty to protect. We've got to protect the kids who are at high risk, and truthfully, if like in a threat assessment, or this kid wants to take more people down with himself, we've got to warn others, and that potentially could happen. Okie doke. This is and you'll see this stuff referenced to CCSD. We did take all the CCSD stuff for our Academica information, but in essence, what it does is it shows you the way to go. I got to tell you what, when I'm in the crisis situation, it's the last thing I want to look at. So I would suggest take a look at it. But the essence is, you have an event, you have to decide, what do I have here? Well, how do you figure out what you have here? You gather some data. If there's any suggestion that there is some possible damage, some harm that needs to be investigated, you move forward. Whenever you see that there's an imminent, emergent issue, you call 911 and get help, and we'll talk to that point. So again, it's gathering data, making a decision with what data you have, and then going forward with that. And there's a little caveat on the side. Anytime the child's behavior becomes violent, call 911. Don't take a chance. Sometimes the presence of a police officer is enough. On the other hand, it may not be, but we've got to do some precautionary stuff, because we don't want the kid to run out in the street. We don't want to have the kid run away like what happened to me. So take a look at this when you're calm, not when you're in the middle of it, okay? But again, the essence is identify your issues, gather data, make a quick decision, and then follow through with how you plan on doing it, okay? Okay, my dear. We have, and it's all uploaded for you. Again, this is for your reading pleasure. I do my reading pleasure on the toilet. This is reading pleasure. But what in essence, but I like the way we set it up. I thought it was kind of brilliant myself. I'm patting myself on the back. But what I did was say, okay, these are the processes. This happens first. This happens next. And then I put a yield sign to say, slow down here now. Here you got to make some decision points. Then there are points here, if this didn't happen, then go do that. So it gives you a step-by-step of, that chart that we had, the flow chart. This is more particular to what do I do? What does this mean? That kind of thing. So you can see step-by-step what has to happen. In points where there are some core issues, like do I need to contact 911 right away? I have put a stop sign there for you to say, whoa, slow down, guys. This is where you have to sit through and think, what's next? Okay, so you've got that for you. Okay, my dear. So this is my I have very limited humor. Holy smokes. Well, what does this all mean? What do you do? So in essence, what I'm trying to show you is you either have a medical emergency, either you're going to have to do an SRA screener. We're going to go through that for you, which screens out, it helps you get an overview on what you have. And lastly, the comprehensive, which is the more in-depth process. Again, that medical emergency is if you find that the kid is suicidal and crazy in his thinking, where he just can't focus or she can't center herself. We need to call 911. Bottom line, you want to keep that kid safe. So that's separate. Or if in fact, again, the one thing I can think of is ingestion and running. We've got to get help there. That the running is different than a medical emergency, but those are when the kid's health and safety is at risk. The screener we're going to go through for you, what that does in about 10 quick minutes is allows you to get a flavor for what you have. The third piece from the screener, then you go to the comprehensive. In some instances, you may just bypass the screener and say, oh, I know we have to do the comprehensive. So again, that comes down to your judgment. So I would strongly suggest look at both of them, kind of get a flavor for what we're asking. The screener has the basic core issues. The comprehensive helps you dig into what got that kid to that point. So you have a much more a clinical perspective, but one that the provider will need, the emergency room will need in making decisions. Okay? All right, my dear, can you go forward then? This is a really important piece. Sometimes I remember walking in the door and finding out no one verified the facts. They're hearing through the grapevine that there might be a thought of this or that. Verify it, pull the kid in, find out, and do an interview and find out what's going on here. Okay, we've got to make sure the facts are correct. Probably in my career, we've had probably 2 or 3 that was misinformation. It was done to set up a kid and it was totally bogus. So for the most part, verify what you have, okay? Has there been a critical event that's recent or a triggering event that has caused the kid to jump? One thing we try to suggest you do, if you can do it, is Facebook. Look at postings, writings, that kind of thing. But I'll tell you what, ultimately, you may not have the time to look up a kid's postings or Facebook stuff. Because if you have the basic information that we're at risk, we're at risk. Just move it forward. Then the core issue is sitting down with a kid and saying, is this true? Help us understand. And you know what you're going to get usually is some jive, some back and forth. I didn't really mean it that way, or how'd you find out, or whatever. And that's where you're slower talking and having them recognize that you really care about how they feel. And we've got to work this out together. I'm here to be with you and work it out. But again, you're going to breathe more calmly. You're going to have to lower your voice, even lower the volume of your voice. So that way you keep them connected and you show them, we're in control. I'm not in a panic. You shouldn't be either. We're here together. Okay. The more you accelerate your pace, the faster you talk, if your body tension, like I said, use your chair to keep calm. The more they can read nonverbals as well as we can, and here see the verbal posturing. So that's where we have to keep calm. So those are the core pieces that are really important. Okay, my dear. Interview guidelines. Let's see. I want to make sure I stay on my track here too. Okay. Most of you understand what active listening is. I remember years and years ago when all this started and we were at the highest numbers we had, I was interviewed by one of the TV channels who actually came out to Siegel at the time and said, what works? And I said, listen, listen, listen. That's the bottom line. Just keep quiet, because when we're tense, we tend to talk too much and we talk too fast and too loud. Sit back and listen. Allow pauses, uncomfortable pauses in time to help work for you. Help that kid calm down by giving him space and letting she or he communicate. So again, active listening is listening with reflection and hearing the stuff, but not really commenting. So that seems to be the best way. It's more of a conversation. So there are questions there. I would strongly recommend that you don't. I know you're probably going to have the protocol in front of you to kind of follow the process, but try to be back and forth in communication, because it keeps it calmer. I hate being interviewed by people, and that happens all the time. It's maddening. We don't want that for the kid. We just want to find out what are the presenting issues. And you'll see the protocol itself is very common sense. While you're talking, watch for nonverbals. You know you've hit a hard point when the kid, they pull away, they get tight, they get tense. You can start to feel that. I'd somehow notate that either on the edges of the paper, or just write yourself notes. Got pretty tense here. Watch for those nonverbals. Stuttering, wringing their hands, shaking, all that kind of stuff are things that kind of give you a red flag. One alone isn't enough. You're trying to pull a full picture together. One big piece that I've learned throughout the years is inconsistencies. Be careful and listen for inconsistencies in the statements. In one statement, there might be this, and you see it on those TV, police shows too, how they go after people. Well, we don't have to go after kids. It's probably easier to say, help me understand this. You said this before, but now you're saying this. Help me understand it. And that way you can kind of figure out, is it evasion? Is it they're trying to dupe me? Whatever it is, call them on it. That way they can see you're listening, number one, but number two, they're not gonna dupe you. You know what you're doing. You've got control over the conversation. Okay? All right, my dear. This is a core piece. Don't make deals. And one thing I just, on the last one, I just want to say, there's active listening, and part of that is called reflective statements. And what that is in essence, you repeat back what the kid said. That sounds like you're saying it was pretty difficult. I bet it was. Or you're just saying that talking to that kid made you feel really bad and that you weren't part of the group. So you're just saying their statements, but repeating it back. That way they know you caught it. You caught it. Because some of those statements are just full of important pieces that you want to catch. And you want them to know you're catching them. Thanks, Becky, for going backwards. But that was one I wanted to do. Okay, I have seen occasionally, and I'm not knocking anybody because this isn't fun and it's not easy. Don't make any deals. If you do this, we'll do that. If you do, whatever, we'll keep this a secret. Oh, many a time we hear this one. We got to keep this a secret. Don't tell anybody. No, you can't do that. No deals. No deals. This is the time sadly, we have to think through. You have to take charge, meaning, no, there are no deals. What we say here really isn't confidential. It's called need to know. My duty is to make sure you're safe. And so they need to know that we're not deal makers. It's going to be shared because you have to protect the kid. Now that's rough. I got to tell you, that's not easy to do. And the kids typically tighten up. On the other hand, we got to do it. We've got to do it because they need to know the issues. And ultimately, if they start blocking with you, then you go ahead with what your gut is saying, but you hopefully will be able to get past that point. You have a duty to, you got to tell parents if they're below school age, below the age of being an adult, we've got to work with the parents. And that's what we have to tell them. They're a team. We're part of a team and we're going to work this together. Okie doke. All right. Verify facts. Figure out what we've got. We've already talked about that. Do the screener, and then we're going to do the protocol, the SRA protocol. Again, that protocol is long and lengthy. I recognize that. You could probably get it done in maybe 2 hours. Again, it's worth every minute of your time because you're saving a kid and you got the kid there. He's a captive or she is captive. So again, you got to do it. Just got to do it. So that's the sequence. An interview, a parent interview. We do a triage, then we look at supports, a notice, and then do a safety action plan. That's the essence of what has to happen. So again, we're making a determination. The screener helps us open it up. But again, some kids, you might just jump right into the full thing because you know you got a problem. Okay, so that's the level 1 and level 2. Okay, my dear. All right, what I wanted to do was have you see what the screener looks like. And there's I'm proud of this piece too. Method to the madness. Again, taking all the historical stuff, all the research, it's compiled into sections, okay? And some of them I've collapsed into the same section because they really meant the same thing. But what I tried to do was the protocol you're working off of, and for the people who aren't psychs here, the protocol or speech therapists, the protocol is the sheet of paper that guides you in the interview. That one on the left side, suicide risk screener, this is the first step. On the one you're seeing on the other side helps you determine and make a judgment with what information you have. So I would suggest you do, is a screener on the site? Yes, everything's on the site. The screener has all the core issues, and you're going to see more of them, but then on the other side it has equal information to help you make a decision. And that was rough. We had to really think through, what would I want you to answer to those questions? So we're looking at warning signs, history, and risk factors. You'll see there's a judgment scale here. It says, numbers 1 to 10. Sometimes when they're starting, the kids are too guarded and they don't give you, oh, I'm only a 1 or 2, no big deal, blah, blah, blah. You got to see the full picture. Again, the preponderance of evidence on that. Okay, Beck, can you go to 25, page 20, next one. There we go. Now you can see it. These are kinds of things that the research has been clear, and honestly, I got to say, after all the years in doing it, they make sense. Is the kid eating, sleeping? Are they tired? Are they depressed? Now they may or may not. You look at the kid too, because you can put a note on the side here saying, it says no, but boy, does he appear to be depressed. Those kinds of things. So again, you take each one and go through them and talk through it. But you can put side notes in there on how you think, okay? Let's see, Becky, I can't see all the way down, but there we go. Well, you know what? That's one too. Go to the next page, my dear. This is the other side. You can either do it on a separate page or put it, back to back. Where's the plan? So see, in essence, we're following a very abbreviated format for warning signs, history and risk factors, and what is the plan? The core, one of the major core issues is a plan. The more defined the plan is, the more scared we get. If a kid has gotten to the point, remember that scale of the staircase. The plan is farther up there on that scale. It's not it's maybe a third of the way up. When they're starting to think of a plan, that starts to scare everybody because they're going far beyond what we want. So they are looking here. What we're trying to find out here is where are the kids thinking? What are they thinking? And what you'll get are details, how to do it, when it will happen, that kind of thing. And that's the big worry. And when we get to the comprehensive, I'll explain that more to you. At the bottom, you're going to see no, low, medium, and high. How do you do this? How do you make that determination? That's where you're going to have to go to the screener triage, which, Becky, if you can flip to the next one, that's how you're going to answer your questions. Yes, my dear.
Rosemary?
Yeah.
I just want to let everybody know that our forms do not say Clark County School District.
Right.
We cannot use Clark County forms. Our forms have been updated for us. They're in the G Drive. We will be sharing them with you.
Right. But I got to tell you, they're very similar. Okay. Right here is the triage. What this does is take every section that you have and helps you break it down. So first things first, physiological symptoms. What is this kid talking about that he has? Emotional temperature. That's a wonderful question. Where are they fitting in? And we give you guidelines. The protective factors. Is there someone there to support the kid? We've got history and risk factors, which you will always see on any kind of, if you were to purchase an assessment, a risk factor assessment or do readings, they're going to look at that. But our goal, I'm reading what Nancy wrote here, but our goal is to make sure, see where this kid is. You can see the big difference between low ideation, no attempt, versus where kids have attempted. They're continually thinking about it. Those are the kids that are high flyers that I think we have to be very, very worried about. Pre-existing vulnerability. Oh, wonderful. Teresa made a wonderful comment. You can be careful what we can be subpoenaed for anything that we write. They're considered school records. They're open to anything. Again, just use judgment. If anything, what I'm finding is the more you put down and you describe yourself, you're much more protected. But again, if you don't need to, fine. It comes down to you don't make like crazy comments like this kid's schizophrenic, holy smokes. That's not our call. That's not our diagnosis. But again, talk to the behaviors. Okay, Becky, can you get down to the next one? Current plan. The more current the plan is, the more defined the plan, where they've thought out how they're going to do it. What kinds of behaviors are risky? This is one thing I wanted to bring up with you guys. We have had kids that really walk that tightrope of being very, very problematic, where they do things that are very dangerous or very risky behaviors. There's a problem. If they're into a sport that is problematic and can be dangerous, we've got to be careful that sport wasn't chosen because it's a good way to get hurt. So we have to watch that. And a core thing I think that I've noticed throughout the years, and put that in discovery and rescue, our kids who really mean it, they've thought through, can they be rescued? And one case I have to tell you that I still am sickened about this one is, and we had no control over it, a kid thought through the rescue and set it up that he would hang himself in his bathroom, which he did, but he had timed it in a way that he knew his mom would be walking in the door. Lo and behold, she was late that day, and he did it. It was a completed suicide. So kids think through, you know, the ones who are intent on doing it do plan that through. The ones who aren't, but maybe using it, that's a problem. We've just got to be pretty careful with that. And so that's something for you to think about. The next piece has to do with your clinical judgment. What's the demeanor? If you have body language that suggests we've got some issues, follow that gut feeling. You have to define what they are, but certainly follow that gut feeling. Then overall, you look at the, always, I learned this in college, how many years ago? Preponderance of evidence is not one single indicator, it's a multiplicity of factors that are consistent with each other. That's how you make your decision. Always err on the side of caution. If you're uncertain that you have not enough information here, you go to the next plan B, which is the comprehensive. If you think you have absolutely nothing, you can go no and low, but monitor that kid, okay? And we'll talk about what to do with each one. Okay, Becky, can you? All right, more method to the madness. I don't know if you can see it, but we have here the comprehensive, and then the warning signs with the triage, but also this mirrors the parent piece. We need to know, and I'll go into that more, where is this parent coming from? So what we've tried to do for you is match those three things. The triage will match the questions so you can determine how much at risk are we dealing with, but also we want to see what the kid is saying, and is it equal to and consistent with what the parent sees, because that's a big red flag. If the parent doesn't know, why don't they know what's going on in that situation? So this gives you a tremendous amount of information. So this, I want to go back to protocol, just in general protocol. If you're going to a comprehensive, call your parent. They need to know what's going on. Parents do need to know what's going on. And even on a screener, what I would suggest is you let them know what happened. When you're hitting into the comprehensive, or you have enough information on the initial referral, like, you know, when they came to you and said, we got a problem, call that parent, get them in. They need to be part of it. If this were my child, I want to know. The same thing with any other parent. They'd want to know what's going on. Okay, and again, they're in loco parentis, which means you have control. We don't need signatures for them to assess the kid. We have a duty to make sure that kid stays alive. Okay? So going back to this, the method to the madness is there's a protocol. The parent and the student is consistent with the same questions, but from a different perspective. And then we have the triage that allows you to figure out, is this low, medium, or high? Okay, doke, Beck. All right, guys, what we tried to do here was a compilation of all the core issues that you do need to have in making a decision, okay? So first things are the warning signs, and is the kid feel a sense of being a burden? The second thing is risk factors, habituation, and again, that's how we look at all the other pieces. Again, you're going to have to do some practicing so you can see. I want you to please look over the protocols when you get it. Okay, Becky, go to the next one. So again, you're just seeing kind of the process. In the student interview, first thing we're hitting, warning signs. And if you can read it, I know this is hard to read off of a screen, but we do a lot of scaling questions. That's it. It's easier for the kids. Help me on a scale of 1 to 10, blah, blah, blah. How do you feel? You might in the beginning get 1s and 2s. I'm fine, because they're being dismissive and they don't want you to probe. You might have to go back to doing go back to it again. What I'm hearing you say is this, this, and this. Boy, 1 seems awful low for you and be not worrying, but you're telling me you're thinking about hurting yourself. Help me understand that. And again, always, I use that, help me understand. And that helps you get through it. So the first thing is that, are they feel a sense of burden towards other people? Are there warning signs? We know what are red flags for us. And these are the questions that will help you get it. The next piece is history, risk factors, and habituation. And I'll talk to you for a second about that. But what we're looking at is prior information in the history. Have you ever thought of this? What stopped you is a core question. And I highlighted that in my notes here. I want you to realize the kid's with you, so something stopped them. If they've been thinking about this for a long time, something stopped them. What was it? And if it's continuing on, why isn't that thing that stopped them, that protective factor, that piece, why is it not working? What's going wrong? Does that make sense? So you'll see through each one of these, have you done this? Have you done that? What stopped you from hurting yourself? So we can know that that's a possible solution, or it's failing in the system for him. There's a point here, exposure to violence, prior attempts, self-harm, acquired capability. And I want you to, that's a point we need to talk about seriously, is, you know, we used to think that suicide, you know, gesturing or possibly cutting was not as problematic as we thought, but it is. Because what happens is kids habituate. We get habits, and we become more accustomed to the kinds of thoughts and feelings that are associated with that. So the more the kid makes a little cut in their arm, or doesn't eat for a day, and then the next time doesn't eat for a couple of days, or whatever, that's habituating, and that can be very serious. The way it first came out, interestingly, we always thought that habituation was not a problem, not a big deal. Well, first we worried about it, and then historically we stopped worrying and said, you know, it's okay. But now it's come back to, this is a possible indicator in our scale of justice and weighing things out. So you got to listen for those things. Are they habituating to pain, or the thoughts of suicide and not being present anymore? Okay. Let's see. You know what, on this last one, I just want to say something. There's a whole section that talks to, you'll see, yes, number 24 and 5 have to do with more out of reality. We've got to just make sure that their brain is seeing the same things and processing the same way we do. Are there any kinds of brain tricks that are going on? Are they hearing voices, seeing things they shouldn't be, hallucinating? We need to know that, because that's an automatic. We need to get them to the hospital. Okay. All right, my dear, can you go to the next page? Pathway to violence. Remember, you know, we showed you some things on where do they fit in. We need to know where they're thinking and where they are in the process. And again, we have that scaling question. Scaling questions are wonderful. I can use them for anything. If you think it will work and the kid responds well to it. On a scale of 1 to 10, tell me, where do you feel on that one? Help me understand it. I put an opportunity to do it. There's a question here. If you had the opportunity, would you do it? Are you waiting for a rescue? And that goes down to that high school case that I told you. This kid thought he had an opportunity to get his mom's attention, and she blew it, but she didn't know it. She was just late that day, and that kid connected, so, and died. So we've got to listen for these kinds of things.
And
okay,
it's going to come right into Rosemary's presentation.
I didn't hear it. I'm sorry. Well, it doesn't. One thing we want to know, remember how I shared with you, some of this gradually is a gradual upward movement. Others hit them like a pile of bricks, and there are current stressors. We need to know that. And so interestingly, and it's really kind of hard, the stressors that you don't think could be a stressor could be a very big stressor. That could be a loss of a dog. That could be anything. It could be, you know, a loss of a girlfriend, a loss of a dog, moving out of their house, being, okay, think about this now with the COVID stuff and all the economical issues going on, being kicked out of their apartment, having nowhere to sleep, living with a new family, living with another family member, and they've all are sleeping in one bedroom. Those are losses and tremendous issues that people are living with. So we've got to talk through what are the stressors that are going on. Okay. Okay, my dear, can you give me the next one? This is the parent interview. It mirrors what we've already asked the kids. The real bottom line, and I wrote this down, I want to just say it to you. Did I know that? You know, it's that kind of question. Remember that one little kid that was a comedian? Did I say that? Well, this is, did I know that? Those kids, we've got to find out why parents do know or don't know. Typically, parents don't know. On the other hand, because kids are keeping evasive. On the other hand, parents sometimes, because they're so caught up in their own emotional stressors, they're gone. It's over their head because they're in survival mode. When we've been able to do some kind of unofficial looking at data, and we had two types of systems going on. The system whereby kids feel and want to commit suicide because they're not meeting the high expectations of what everyone thinks they should be doing. And then there's the other element, and there is parent involvement, but they feel a sense of pressure. There's another type of kid that is they're on their own devices because parents themselves are in crisis. And those kids use their friends who sometimes promote some of the thinking. So that is a very important piece. So we need to know where the parent engagement part is and their movement forward. So ultimately, you're going to use a scale of justice and weigh out these factors to figure out where this kid fits in. Becky, thank you. Can you move to the next one? Holy smokes, our time is fast. This is the triage. Again, we have ours all set up. I can't get it off because it's on a PDF, but ours just says Academica on there. But the point is, this is the triage. So in essence, what we've done for you is broken down low concern, and then there's ways to manage, to medium, high concern, urgent concern. Anything, all of those kids, you want to make sure there's supports in place, but more action will have to be taken with high and urgent concerns. Okay, Becky, can you go to the next one? What this does is follow the protocols for all of them, the parent protocol, the kid protocol. We also have a protocol for you. You can interview other people if you choose to do that, but the core is the parent and the kid. But what we're looking at, these are the warning signs that are currently noted: sadness, worthless, hopeless, helpless, eating changes, sense of burdensomeness. That really is so interesting. And trajectory of warning signs. Is it a stable and then just jumped up, or has this been going up consistently because no one has responded? Okay, Becky, can you go to the next one? Next one is habituation, where I told you they get used to this. There's a history. Prior attempts, cutting, self-mutilation, gesturing is very different, but it also, why is it coming out if there are gestures? Substance abuse, exposure to violence. See, I think that's why we're all kind of worried with this home distance learning. If there are issues or family dynamics that are pretty prominent in that home situation, and sadly exacerbated by a terrible economic environment, and everybody stuck at home for 24/7, this is a problem. These poor families are really having a hard time. Does this kid engage in provocative behaviors? Are there eating disorders of some kind? Is there more than the normal developmental depression? Is there a labile mood? Is there interpersonal emptiness, interpersonal instability, storminess? We need to look at that. Hallucinations, that goes down to, again, the behavior that we have to take care of. Auditory commands, we've got to really deal with quickly. Okay, my dear, can you go to the next one? We have to look at that pathway to violence. Okay, is the kid moving forward? Remember that scale I showed you? Is the kid moving forward? Is the time frame, are there established issues with regards to the time frame? Is today the day? Is there urgency? Has there been preparation? What's the kid's level of comfort in saying, I'm done, I don't need this, I'm not a failure because I've made a decision just to move on? So again, this will help you make some decisions on this kid's attitude. But you can see the quality of diagnostic thinking you have to use. That's why I want you to look this over before you do one. Okay, my dear, can you, okay, a critical point, you can see critical element with the asterisk, and it's the parent. All right, where does that parent fit in? Okay, our risk level would be low if this parent is connected to provide support now that they know, or whatever. If there's passiveness, I'll do it because you're making me, but I really don't care. kind of thing versus total disinvolvement, disengagement, where probably CPS will get involved. Those are issues we need to deal with and need to know, because the kid is sharp enough, any kid is sharp enough to know how engaged their parent is. Now, this is an issue, I highlighted this and I brought it up earlier. Loss of a person, relationship, a thing, loss of a goal, a hope, a wish. Now, those are things we fail to almost think about, but if they've had, it's easy with boyfriend, girlfriend stuff. What if they've lost something that they really wanted and had and lost? That's awful. What if they had an agreement or a need that their goal was to get into college and they were rejected from college? Those are core issues that in their brain, you have to, again, think like a kid. Would that be the end of it, where they would say, this is enough? Now, maybe because we're adults and a little bit more savvy, but to a kid, to lose something that they had all their hopes and wishes on is problematic. So again, loss of hope, goal, or a wish, loss of a thing. It could be anything from an animal to their favorite car they worked forever on and it's gone, or whatever. Loss of the relationship in person are also core issues, but those are the typical ones. Okie doke. This is core, and I think, again, this is where the COVID stuff comes in, but what are the current stressors? The goal is to see how self-determined, how much control the kid feels they have over themselves and their lives. The less control they feel, it becomes, as I wrote up here, perfect storm. So what we have to do is see what are the stressors and are they managing it? Very interestingly, I'm going to go back to that scale of justice. Some kids have high levels of stress, but they are more self-sufficient and know that I can manage this, I can get through this. But I think a lot of kids, especially now with the COVID situation going on, they're feeling much more ineffective, ineffectual, and there's an external locus of control because there's so many things we can't control. You kind of have to look through this and make a decision on how much control this kid feels he has or she has over their life at this point. Make sense? So this can bring the kid over the edge or not. Okie dokie. I put on my notes here, and I want you guys to know it. Physical presentation. This observation is critical. This is where you become a good you are good clinicians, and you're going to show it. You've got to look at the kid's affect and see how well he's engaging with you. Is he tap dancing with you well? Did you see some tension at first, but then it diminished, so you were able to get to the crux of the problem? You also have to confirm it and support it by looking at those nonverbals. If they're inconsistency with verbals and nonverbals, we talked about this before, you got to call them on it. Let them know you know. Okay, what's going on? You're shaking all over the place, but you're telling me nothing's wrong. I need to understand that. Those kinds of things. You're telling me you're happy, nothing's wrong, but you look so very sad. You have no zest, no energy level. What's going on? That way you can make a decision on the well-being of this kid, because that's a critical piece. Okie dokie, what you do then when you're circling each one, you circle and find the preponderance of evidence. Where are the core areas? And then look at the areas of concern and make decisions for that. Make sense? Again, we're looking at bulk and preponderance of evidence. Okay, from that point, then we're going to go to the next pages, and it goes from different levels. Low risk, those were all the areas where the kiddo is kind of managing. They're not high concerns or has enough savvy to know how to manage and has enough supports. You discuss with the parent what the results were. You figure out the supports, you document and keep an eye on the kid. That's in my mind the best way to go about doing it. Keep an eye on the kid. Always be available and let them know. Let the parent know. If you see any red flags, it gets worse, or tells the kid, yeah, I'm here for you, kiddo. Come by. We'll figure it out. That would be the low risk. Okay, my dear. Moderate risk. Here's where we may have to infuse some outside supports. And based on professional discretion, we have to figure out what they need. This is not the point where we're looking at psychiatric support. However, you want to get the kid to do some counseling services of some support. At least if they don't accept it right away, they might need it in the future. So tell them, I think your kiddo could probably benefit from some outside support. It's more than education. We'll provide some support here because you can do a safety action plan. We'll provide some support, but the issue will be what in the home environment is happening, what will happen at school, that we want to keep it at moderate and go downward to low. But we want to know that we're not going to leave this kid hanging, because it truthfully could accelerate to something higher if the kid feels we're not doing anything. Okie doke. Can we go to the next one? There was a question about some stuff. I don't know Hazel Health, guys. That's a new one. We'll have to look at it or call them. Moderate risk. Okie dokie. These are some places that are available. I noticed someone asked about one location. I don't know that name. What I would suggest is call them. And if you think it sounds like a good one and you get good feedback, tell us about it, because certainly we'll promote them too. So if the parent has no insurance, the state of Nevada, the suicide response team, they can all provide services. Center for Health and Learning in Kayenta. What I would do if I, go ahead.
Well, Rosemary, just so you know, some of our schools have Hazel Health, and some of our schools have another telehealth service. The last time we talked to Hazel Health about providing mental health assistance, they were looking into it. I don't know about the other system that Matter uses, but Donna can let everyone know and respond to this in an email.
That is perfect. I'm so glad to hear that, because that's a new name to me. I'm not familiar with that. Okay, good information. But not for acute. Matter has telehealth mental, but not for acute. Thanks, guys, for this information. Well, I mean, we really do need to know that. Donna can find out, but I don't think so. Okay. Again, the phone calls will be dramatic, and if you got that parent in your hand right there, do it. Call them for them. The information is there. I always call customer service and say, I'm not the person, I am helping this person. Can you help me in determining, can you provide services? So any way you can help them, because I'll tell you what, the issue is they're in crisis right now. They can barely understand what you're saying or hear what you're saying, let alone do something. So you have to become very directive and very controlling, but also show your soft sign of, I'm here for you. I'm going to do whatever we can to make your life simpler and help your kid. So that's good news. We'll get that information. What you do once we have a location is letter to provider. You complete it. You give them a home precautions form, which in essence says, please guys, oh, here we got another one. The student on SSR, I think that if a student is on SRA, yeah, with black box warnings for suicidal ideation. Good. We'll talk about that. Letter to provider, which you have a copy of, and it in essence breaks down, and we've got a copy to show you. Home precaution form, which says, Mom and Dad, if you are ending up having to go home because you have an appointment tomorrow, make sure the house is clean. I've said that to more parents than I hate to admit, but in essence, I've said, take care of anything that you think this kid could use to hurt you. If you need to sleep in the same bedroom or have them sleep on the floor in your bedroom, any way you have to keep an eye on this kid. And that parent notice, there's a notice saying, Mom and Dad, we've done the assessment. We want you to know that, you know, you need to sign this saying we did it. Many parents don't want to sign it, or they walk out because they're so panicked and want to get to the hospital or whatever. And you just notate that on your form. Okay, my dear, can you go to high imminent? High imminent. Okay, you got two ways to go. If you have an uncooperative or a cooperative parent. A cooperative parent, thank God, those are the easier ones. You contact the provider and you figure out what type of emergency services you'll need. That could be as high and emergent as going to the hospital or going to a provider where they will do the intake there and do the assessment. Or it could be a different type of level where we'll have to just work through emergency services and through the ambulance. The other is the uncooperative one, and that's where we have to use police. In CCSD, we have to use the provider. I'm sorry, I lost my train of thought. If it's uncooperative, we have to use police to assist us. We cannot complete a legal form. I've attached in your paperwork what a legal 2000 form looks like, but also, if I'm not mistaken, we have it in here so you can see it. But they're going to be looking at whether or not, from a legal perspective, can the police sign that paperwork. Becky, we'll go to the next one. In those instances, once we've made a decision, and we'll go back to the forms in a second, if in fact you have the provider, even if it's the emergency room, say these are the presenting issues, okay? It goes back to the same thing we did with moderates. Here's a home precautions form when your kid gets home. We do the parent notice form saying this is what we've done, and then we let parents know, especially if the kid's going to the hospital, but when they come back, safety action plan. Every kid who's been to the hospital, every kid who's been deemed to be moderate, we need to do a plan, and we'll talk through that for you, because that helps us plan for the future and what we're going to do with this kid. Okay, what I would do if I were you guys is let this kid know what's happening before it even happens. They're scared to death. So explain to the kid what happens. You get so much more support. Let them know if they're, ask them, I'm here to support you. Tell me what you're afraid of. I'm telling you what's going to happen. What are you afraid of? Many of them will say, my mom's going to kill me when I get home. I need, it's that kind of thing. Then I said, honey, then we've got to deal with this together. Tell me what the issues are so I can work with your mom for you and with you. So we're giving in my mind, we're giving the kid control. We're saying, where do you need help here? We're not going to leave you hanging. We're here to do this together. So many a time I've asked the kid, do you want to be in the room when we talk? Most of them do. I'll ask them, how do you want the room set up? Where do you want to sit? You want to sit with mom and dad, between mom and dad? You want to sit near me? Whatever it is, give them that sense of comfort, and they get some power and control over that, because they're scared to death, as are the parents. And we can be too. Okay, my dog. Next one is letter to provider. These are the questions. How serious was the plan? Viable, place, substance abuse issues, level of depression, risk factors, any possible medications. And put your information on there, who they can contact in case they want to call you back. We've had that happen many a time. They'll call you and say, please give us a little more read on this, that kind of thing. So you're giving them a head start on all the information. Some instances, we've been asked, what did they say on the protocol? And I give it to them. Tell them what I'm hearing. So it again gives them a fresh start, but also they're not starting from step one. Okie dokie. This is what the letter to provider looks like. It has just the basic stuff in there. You put your information on so they can contact you. Okay? Let's see. Becky, can you throw the next one on? Here's the letter I keep talking about. A parent signs this saying, this is what we've agreed to. The kid needs, if he is going home, but once he's out of the hospital too, they need supervision. Stay with that kid. So we're alerting them, have visual contact, be aware of anything, clean the house up of anything that could be used for to harm themselves. Now, again, I understand all that, blah, 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 need to call 911. Once in a while, we've had parents saying, I'm not going to sign. Okay, then you notate the parent refused to sign. In some instances, because it's so chaotic, and if an ambulance has come, it just doesn't happen, just notate it, that happened. So that way, it was something to do, but we just didn't get to it, or the parent refused, okay? Okie dokie, guys. Here's the safety action plan. I'd use that almost for every kid, even the low, if you need to. But in essence, what it does is, it's done in collaboration with the kid and the parent. And what it is what do we need to worry about? How do we get in touch with you? When things go badly, what will this kid display? And then from the kid's perspective, what do I say when I return if the kid were to go to the hospital? But you know what? The kids might all know that he or she was interviewed by you today, and he's got to come to school tomorrow if it's not a high imminent. Well, I was just having a bad day. Or practice with a kid, role play. Then we have to give the kid some tools that if he starts to feel like this way again, what do we do? How do I handle it? Identify a safe person and a safe place. the first day on reentry might be best to have them come down and see you. So you talk with the kid and the family and decide what's the best way so that won't be so scary for them. Okay? Okie dokie. Here are the urgent risk mental health hospitals. As you know, I don't know if you do know, Monte Vista is no longer on there. They're not providing services. So these are our main go-tos. And again, what we would do is contact them, and you would hope that they will, provide you with a plan or a treatment plan that may not have all the information. I've received multiple ones that don't have all the family dynamics. I don't need all that, but what do you recommend for the kid for school? So these are the available options. And again, it all comes down to whether or not the parent, what their insurance covers. And again, Desert Willow is the state-run facility. And everybody's been wonderful to work with. Okay, my dear, can you flip it to the next one? Emergency room, again, that's a medical emergency. If you think the kid's ingested drug, and get your nurse in as fast as you can. Call them if they're not on site and just say, this is what I see. Again, though, if the kids stabbed themselves, if they're caught in the bathroom, if they tried to hang themselves, if they've ingested and you can tell they are just out of it, call 911. You have to, but make sure your nurse knows what's going on too. Holy smokes, students attempting in your presence or may have seriously attempted. You got to get that emergency room, call 911. Just use good judgment again. Again, we don't want any kid to die just because we're not sure. Just take care of business. If you see that there have been issues with regards to reality contact, remember we talked about whether or not they're in reality, are they getting hallucinations? We got to watch for that because there is a problem. Either we get them into a psychiatric eval, or they are so out of it, we may have to call the ambulance to get some support. And that has happened, so we've got to be careful. We always have to watch for viable plans. If those viable plans are right on, very specific with lots of details, got to watch that. That's a problem because you just, without supervision, we can't guarantee parent can provide supervision and the kid's in our control, then we've got to make a decision. Again, I have to reiterate, if you sense parents are going to be problematic, put the parent in one room, put the kid in another room, because you don't want volatility. Okay? Okay, my dear. ER points, these are important, and we learned these through, whatever. We send a letter to the provider to the emergency room and ask for the charge nurse, saying who you are. I'm the school's crisis team. You have a kid coming your way via ambulance or by the parent, and then let them know what's happening. Identify which hospital, because that's something we sometimes forget. As the kid is going into the ambulance, ask them, where are you sending this kid? So that way you know what hospital to contact. And we've had that happen a couple times. They're in the ambulance and think, oh crap, I don't know where they're going. So you want to forewarn the emergency room who's coming, why they're coming, and send that fax over so they have some information. Another issue is if the parent is not there, say for example, you've worked at it and the parent can't get a hold of the parent, but the kid has to go, then somebody from the school needs to go to the emergency room. You can't just, and it's happened that the kid goes and is dropped off. We can't do that. We've got to have somebody there. The point is, and I know this has happened, don't go in the ambulance, bring your own car because you've got to get home. So make sure that that's taken care of, but your school principal will give you the direction with whom he thinks or she thinks would be the right person to get on and to be there for that kid. Can you imagine if that kid goes there without a parent? I mean, that's got to be frightening. So at least a school person there can be helpful, but we just have to make sure you have a way to get home. Okay. Let's see. Okay, next screen, Becky. Thank you for doing this, Becky. Emergency room transport. Okay, we've had parents ask, can I drive my student there? Well, boy, that's a problem. I get it, because it's scary for any kid to be in an ambulance. The issue will be, can the kid jump from their car? We've had kids jump from cars. So the issue is, can that kid be safe? Now, I have to say, I know like in my car, once I start the engine, all the doors lock and you can't get out. I don't know. We have to talk to the parents to say, how safe do you think you can be? That's the issue. So some thought has to be processed in that. If ambulance, parent needs safety precautions. Well, we already talked about that. I don't want to keep going over things again. So again, really, when it comes down to that ambulance, some serious questions have to be, can you really manage your kid? Because we don't want them running, and we've had that happen. Okay, let's see. Legal 2000 is always dicey. It's a police function only. We do not complete a Legal 2000, but like I said prior, we even put together for you a checklist. These are questions that they will be asking you as to whether or not, this kid really needs it. Some of these guys, we want to make sure we are not. Yes, absolutely. Rob brought up a wonderful point. Never take a kid in your car. Never, never, never. I wouldn't even take a parent in your car. That we have to either have the parent or use an ambulance. You do not need that liability because you're under as much stress as that family is. No, absolutely not. Think about it. What stressors you're under, it's not going to work. So no, you should never put a kid in your own car. The Legal 2000 guys are going to come. They're the only ones. We don't have school police in our system, so we're using the local jurisdiction. I have to share with you, there are 3 here. Everyone I've encountered is different. I've had, and I've said this to you guys many a time, I've had some police officers saying to me, what do you think? And I'll say that, and they'll confirm it and move with it. I've had other police officers say to the kid, you are not thinking of this, are you? And it's a setup. And those poor kids are just beside themselves. And I'm having a fit myself because I'm thinking you're leading this kid and we have to take care of that kid. So the issue is we have to determine whether or not the legal is, going to be used. If in fact they do, we lose control once the police walk in the door. So have your documents, pray that you have somebody who is willing to listen to you, have your mental thought process together saying why you called. This kid's imminent because he said this, this, and this. He acted this, this, and this, has a history. So that way you can show the police officer what you're thinking and they become more reasonable in their decision making. So please be careful with that. Just make sure you have your thoughts in place or write them down so you can talk through it. Because it can be kind of, they'll send a couple guys, and sometimes I've seen even here at this school, we'll send a couple cars, and here you are. It's very frightening sometimes. So those are things to think through and how you're going to manage. We also need the police if the parents do not act responsibly. If the parents are saying to you, no way, Jose, I want my kid now. Guess what? If you think that we've got a problem, we've got to deal with it. So that's a core issue because I know parents have control, but we are in school, it's in loco parentis. And that's where sometimes that police presence helps you lower the tension in the situation. It actually accelerates it a bit for the parent, but it lowers it because then we have a little more control. If we lose our parents, meaning you've made exhaustive attempts, call them at work, call them at home, use family members to say, do you know where so-and-so is? Can you call them for me to call the school? Which we've done many a time. And most of the time you get a parent calling right back. However, if you have no parent response, then this is part of that potential for illegal also, if the kid scores imminently. Okie doke. Okay, we put together, and it's the Legal 2000 supplement form for Academica. It's something for you to look at. That way you have information because again, the officers I've seen, they vary. Some will say, we're making the decision, back off, and others will look at your information and document it, and that's wonderful, and listen to you. So the form is there because it's the same, it follows the same format as what their legal form does, but it helps you answer the questions intelligently. So that will help you. Officer signs the form. And again, once you know what ER they're going, like I said to you, make sure you find out which one. Then you send the letter to provider, which tells them what are the presenting issues that you see. Okay, Beck, we'll go to Okay, this is the form that we put together, you know, just to give you some ideas. These are the things that you can say, low or medium or high risk, and this is from your protocol. Okay, their protocol showed he was on the pathway to violence, has a history, no supports. SRA wasn't completed because it was emergent and we couldn't. Whatever, the student clears a present danger to self or others. Those are the things that the police are going to have to sign. So if you think this through, you'll talk more intelligently, but you'll also have documentation. And Teresa had brought up the point, you know, lawyers can subpoena anything. This shows that you're documented, and that's what we want to make sure. And how did you verify this? We did assessment, we observed, you know, talked to the kid. And again, anything that you see that says CCSD, we have got that. These were all PDFs. We got them into the regular format that you can use. Okay, Becky, can you go to the next one?
There.
Thank you. There's the real one. This is what the police have to look at. So I just wanted you to see, but it has the basics in here that they have to address. Okay. All righty. Next one would be safety action plan. Always plan. You know what? I put in here high and moderate to and above. You can use it for low too. If you think you want to set up work, do a plan so the kid feels he's in control when he walks into school. If there are any health issues, you got to get your nurses involved. Bottom line, we've got to. School psychs, social workers, counselors, they're going to be the support piece for this kid. And the triggers and warning signs, we need to address those so we can figure out what to do. Core piece, and I can't see it on my screen, but what are the kids, make sure they know what to say to their friends when kids find out what's going on, because inevitably they always do. So we've got to watch out for that. Okay, Becky, next line.
Doesn't it go?
Oh, it makes me feel glad that somebody else has trouble with it. So. Management system. How do we handle and manage? What do we do for his emotional temperament or her emotional temperament? How do we help them cope? Now, if everyone's going to say, well, we're an educator, but there are things that we can do. We need to let them know we're going to re-enter. We're going to figure out how they will feel and what we can do to help them feel promoted. Always try to figure out a safe person or people that they can go to, and they'll help you identify who that would be, and a safe place. Where can they go? Most kids typically want to go to either their favorite teacher or favorite counselor's area, working area. Some kids go to the bathroom. I'm always worried about that, truthfully. We need to keep an eye on these kids. And then what do we do for the educational programming? I think our teachers, and you don't have to, how can I word it? You do not have to disclose a lot of information, but the real, it's only a need to know. But the real issue is this kid may need to have adjustments for homework, adjustments all the way around, and that's where you as part of the crisis team will be part of that decision making. Some kids have re-entered on a half-day basis. Some kids we meet and greet at the door and then guide them. Some kids don't want any part of that. It comes down to working it out with the team and with the parents on what would be the best way for this kid to re-enter and how they can manage throughout the day. Okay, let's see. If at all possible, we've had parents go against this, but if at all possible, get a release of information on the provider, so that way they can help us. Tell us what will work. Tell us, we don't want to know the family stuff. We just want to know what can we do to help this kid cope. And we want to establish a connective relationship with you, so that way this kid is successful. So that's, again, how you provide your supports. Okay, next one. Document, 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 guys, and we have all the paperwork there for you. Keep in mind that under FERPA, and this is what Teresa was alluding to, but also parents can review files. So you always write information that's professional, no hearsay, that kind of thing. You handle it in a way that's professional, keep it factually based. Okay, my dear, next one. Oh, can I just say, we don't have to go back to it, but there's a SIP tab now, SISP tab, that allows you to identify a kid that has been identified by the crisis team and has had a suicide protocol. Okie doke. Those at greatest risks, this is from a theory, but it really fits. Witness a suicide or the immediate aftermath, and they call that geographical connectedness. Psychosocial, somebody they knew or connected with or kind of had some kind of somehow connection, they may not even known it, but a psychological or social issue. The other is pre-existing vulnerabilities, when there are really high issues and then a trigger hits and they're gone. The combination is really problematic, especially for contagion. So if the kids are connected geographically or whatever, we may have some issues. Okie doke. I'm watching our time, guys. I have 10 minutes. Contagion, guys, I want you to be aware of this. If a kid dies by suicide, there are point or mass contagions. Point contagion could be something where there's a situation in the local influence. I can't tell you, we're all worried about this COVID stuff. Keep an eye, because if the family is falling apart, our kids lose their support. Mass contagion is when someone has done something, or these kids will connect together. We have to keep our ears open. They're rare, but I got to tell you, it does happen. And it also happens with the kids who, will self-harm, where they kind of get in clusters. We've got to have our connections good. Like I said, get a mailbox and put it in your entryway of the school or near the counseling area. And kids can, without telling you, their name, just identify we've got some problems. So watch out for contagion. Okay, that can be a problem. Becky, can you go to the next one? Chronic threateners. Okay, and I wrote this absolutely. You got to be careful. Take the threat seriously. When kids chronically threat, it's very possible they're thinking of it. However, what we've got to be careful of is the fact that they might just do it because no one's paying attention to them. There's a reason why kids chronically threaten. They may not have the guts to do suicide, don't have all the variables that would contribute to be a high or a medium risk, but there's a reason why kids are doing or saying things like that. So we got to dig to that point. When to take it, okay, let's see. Take it seriously. Okay, that's really the essence. Keep an eye for that kind of thing. Those chronic kids who keep coming saying, I'm gonna do it. Today's my day. Okay, let's do it. And then it's negative. Okay, baby, I got to understand. You're doing this every day. What's up? We got to talk about this. Okay, my dear, can you go to the next one? Behavioral communications when the has no minimal relationship. Okay, these are just various things to take seriously if you see an event that would trigger it. But again, I would take it all seriously because mental health wise, that's not normal behavior. We've got to dig to the extent and figure out what's going on and work with the kid, get some answers. More than likely, just some counseling is needed, but we need to address it. Okie doke. Becky? All right. Community assessment, Harmony Healthcare. There's the fax, the phone number. This gives you all the directions on what you need to do about the facility. Okay. Then the next one is, I've taken out the option of Monte Vista just so you can see. Becky, go to option 2. Spring Mountain, again, they've been around forever. This is their process. They do have acute care. I've called and confirmed all that. Now, I hope nothing's changed in the last little bit. Option 3 is Desert Willow. Those are for kids who, that's very limited. I talked to their people actually about a few weeks ago, and they have to go to the ER first. They're under the state of Nevada. When I worked for the state of Nevada, any kid who had therapy, they were, oh yeah, please, thank you, call anytime. Yeah, Desert Willow is a little more different. Again, the clinicians who work there get first pick on the availability. So, but that's when there's no insurance. So that is definitely an option. Next, for number 4, Seven Hills has been very accommodating recently, I've noticed, and they also have the assessments. They're in the southern part of the community in the Green Valley area. And then the next one is, Becky, can you go to 5? Yeah, there we go. Desert Parkway. Desert Parkway we actually took the social workers, we took a visit about a year and a half ago, and they have become very impressive and provided a lot of support. I've been very pleased with what I've heard and the outcome. I think they've had some personnel changes recently, which always, but that happens everywhere in these hospitals because they're so stressful. Okay. This is for moderate level, but I'll tell you what, they've become much more pronounced even in the higher level. It's the state crisis team. The state crisis team, they've been trained. I watched them. They came to our department and when they started the team and said, what works? And so we shared with them and they have built themselves up with multiple therapists now. So the issue is they can provide services for 30 days and then they will refer out to what is needed. And I have heard, I ask, how is the level of service? I'm hearing nicer things about it and a collaborative effort. So that's all good. Okay, next one, Becky. FAQs. Okay, I don't know if you guys know the term medically RPC a kid. In essence, what that is, oh, thank you. Olivia, thank you, hon. Anything you can add to that? A medical RPC is a term that you can tell a parent, it's happened. A parent's been told, we're RPCing your kid, meaning you have a required parent conference. We're going to medically, because you got medical issues, your kid can't come back until we talk. You can't do that. You're denying kid access to a free and educational, the FERPA issues. Can't do that. You deny access to school. We can't do that. We got to work for this. Physically search a student, yes, but never do it alone and always make sure your admin are part of that. What if a kid runs out of the school? Call police. Okay, we've had a couple situations here. They were slow enough and the staff ran out and got the kid because it happens. It happens. Use judgment. You may have to call police, honestly, because that gets really dicey. What if the kid runs and they run away from you and go into the street? That's my biggest worry. What if parents threaten to take the kid out? Well, I'll tell you what, this is in loco parentis. We don't want that to happen because we have control. That's why I said sometimes you need to separate the kid from the parent so you can talk intelligently with our kid and with the parent. Let's see. I think we're at the point. Becky, can you go to the last one? I've given you some resources. These are different types of information you can pull from. If you pull up suicide intervention, you pull up Richard's state of Nevada suicide prevention office. He's got loads of connections to lots of resources. We'll do anything we can to help you because, it's a learning experience. Again, I can't underscore the most important thing to underscore is look at the paperwork before you even have a case and have some files ready to go because it gets scary. So you're more than welcome to call. I noticed Nancy gave our numbers. Very importantly, and she said she'll put out a list of the locations, agencies that are available. If anybody knows any new information, tell us, we'll share it. I notice we have 25 chats here. We'll do anything to help you because these are dicey times, but the way to make it easier and give you more control is look the stuff over now before the event occurs, but we're a phone call away. Okie dokie, guys. We'll look at your chat questions. Does anyone have any, questions? You please put them in the chat. We'll take care of it, okay? And thank you for your attention.
We really appreciate everyone coming. And if you have any questions, let us know in the chat box or email Rosemary or myself, and we'll get answers to you within a week. We'll share everything on the G Drive. I want Rosemary to make sure all the correct PowerPoint and documents are up there. The next in-service we have on suicide is the SOS training, and then I sent out 2 Zoom meetings, one on the threat protocols and one overview of threats that can happen for the staff. So your administrators, I sent them to school psych, social workers, counselors, the administrators, and the nurses. So look for those. Thank you for attending and taking your time out of your day to attend this. If you have any questions, email Rosemary. I get enough emails.
I
Okay.
do. I know. I get it.
Yes.
Thank you. Guys, we thank you for the time.
Yeah, bye.
Bye.